right, I'm excited to go talk about some hormones today. Last time we tried to have this live, we got shut down somehow, couldn't get in the live. I tried to go live, she tried to go live. So today we're going to be talking hormones and I'm ready to learn. I've been doing a lot of interviewing recently and learning a ton. I learned a lot about estrogen and progesterone, relations with things like breast cancer, and how, to be quite honest, Dr. Simmons educated me a lot on the fact that she doesn't think estrogen has anything really to do with a lot of the different breast cancers and things. So that was an interesting conversation. So now we're going to be talking about hormone replacement therapy. We're going to be talking about how to use it, when to use it, why to use it. I'm be a little excited about this today when Doctor gets on here. Hello there, Shiny. How are you doing today? While I'm waiting for her to jump on, I got a few people. Healing from POTS and the fluctuation of blood pressure right now. Super excited for this. Hello there, is it Jenkins? All right, well, Dr. Francesca is supposed to be coming on here. Let's see if I can see her pop up. Let's see. Not yet. When I was doing my interview with Dr. Jen Simmons, who is an expert MD in breast cancer, I'll just talk about that a little bit while we're waiting on Dr. Francesca. She was educating me all about a number of different things. So one thing being that mammograms, she was talking about how mammograms are not preventative. They are a detection tool. However, they are a detection tool that gives radiation and oftentimes finds breast cancers or different types of abnormalities in a breast that in many cases would never even lead to breast cancer. So she's developed a new technology that has been designed for actually detecting breast cancers that doesn't use the radiation. She also just brought a point to bear that I thought was really interesting, which was when it comes to things like breast cancer, we blame estrogen off. And breast cancers have started happening, but estrogen's always been there. So as she went through her research, if you don't know Dr. Jen Simmons, well, hello there.
Hi.
Well, good to talk to you live in real time since
Here we are.
Instagram will allow it today.
Yeah. Let's do it.
Well, I told everybody we're talking about hormones.
Yeah.
Where do you want to start since you're the expert? I'm just here to learn.
Well, I'm also your student too. So where should we start? I don't know, millions and millions and millions of women will be entering menopause within the next year. So let's talk about all the women in perimenopause that are going to be there.
Hey, that's a good topic. We just looked at my clinic.
Yeah.
And the average female that I work with is 35 to 50, just by random chance. We were just looking at the numbers. I was like, oh, okay.
Yeah. I mean, that's literally my patient base too. It's wild. There's so many women out there, and I know you know this because you're taking care of them too, and they're just scrambling, suffering. It's not cool.
Definitely. I see a ton of women all the time. Their Dutch test, which if you don't know what that is, that's one of the most popular hormone tests, is a wreck. And they're living in this society with all the toxins, with all the stress. So what do you do to help these women?
So first, I think it depends on where they are in their perimenopause journey. So this is like so interesting because even in my own perimenopause journey, I really couldn't pinpoint where I was because I had a couple kids in that interim. So that really complicates how you feel. It's very confusing. Throw in some grieving, throw in some trauma, and half the time you don't know if it's perimenopause, grieving, PTSD, unresolved trauma. It's just like, whoa. So let's say if we break down, women in their maybe mid 30s, and they're just starting to out of nowhere have debilitating anxiety and fears and disrupted sleep. You know, we start there. What's the quintessential allopathic plan, right? Antidepressants, anti-anxiety, go about your merry way, you're too young to be in perimenopause. And I think that's a real disservice, because the truth is, if we did a full hormone panel, we might find some stuff. And then if we take it a step further, we might find some deeper root causes that are really throwing off the body's ability to deal with the added stress and toxins. Like, you know, we talk about the liver and we talk about the gut. So this is interesting. We should piggyback off of, I got a comment on a post that I recently did by a medical doctor who said, you know, that I was doing a disservice to my community by discussing the liver, because no matter what, estrogen is going to decline, progesterone is going to decline. It doesn't matter. What you're talking about doesn't matter. They need to be on hormone replacement therapy. We don't need to look at, you know, the gut and the liver. And I thought, well, wow, that's really a responsible thing to say, because the truth is that, I mean, you know as well as I do, how well is any protocol going to work, whether supplement, nutraceutical, medicinal, if your liver detox pathways are sluggish and your gut is inflamed because you have an underlying infection? I don't know. It's just me.
Oh, I can't agree more. Honestly, like people come into my clinic and I'm like, let's clean up all the basics before we go into pharmaceuticals. Although some women may need hormone replacement therapy, absolutely. But can we look at like I don't know, do you drink too much alcohol? Do you not sleep enough? Do you eat a super high toxic food diet that is stressing out your liver? And why do we talk about liver? Why is liver important to hormones? I don't know. It breaks down and conjugates all of the hormones. It turns them into things that we need, such as, for instance, thyroid, for instance. If your thyroid markers aren't good, look at your liver and your gut first. Don't automatically go to my thyroid doesn't work, because
100%.
it's the victim in that circle.
100%. And, you know, I find too, especially with, you know, women, I oftentimes get a lot of women that have been on HRT and it's no longer working. So they find me and they're like, could it be that there's something going on deeper? And I said, well, if it's not working anymore, you know your body best. So let's see. And then what do you find? So, you know, very typical. So I live in the deep South, and women that come into our clinic are full of mold and heavy metals, because our water quality here is horrific. So we have that battle, right? You've got to kind of do that in stages and tighten all that up, and then see how's your body really adapting. Some of these women actually, once you improve upon those detox pathways, they find that that original prescription no longer serves them, right? Because that was at a time when things were kind of wonky, especially from a detox standpoint. So then you kind of tighten those things up, and maybe they still do need hormone replacement therapy, but then you really need that hormone savvy doc that is going to say, well, then maybe this wasn't the right dose, the right form. We have to kind of tailor that to you. So that's why another kind of issue I have, I don't know if you're familiar in your area or not, but these pellets, very popular. And I think that that's kind of like a cocktail that's not getting specific enough for the woman, for the patient. Very difficult to titrate specific hormones within a pellet cocktail. And the most common feedback I get is, been on the pellets for, you know, 3 months, worked great. I'm on month 6, they don't work anymore. And the practitioner just keeps upping it, upping it, upping it. It's like, let's go look deeper before we do that.
You know, I have a story that just came to mind as you're talking about this, and I was just working with a woman, and she came in. She had autoimmune diseases. She had fatigue. She was brain fog. She was in her mid 30s, upper 30s, and she's really happy with our care and feeling really good. We reran labs at the very end, and her cholesterol's bottomed out. Her liver enzymes are sky high for what we would want to see, like 300, so they're high. Her T3 is 300. She was on a medication when we started. For T3, which she needed at the time. It was in range. We did all the testing. And within 4 months, so it's not like we even went that long, we started detoxing. And all of a sudden now that medication is way too much for her body. she at first was panicking, and I was just like, oh no, this is probably a very simple situation. Go back to your MD, say, hey, I think I might be overdosed on this medication now for where my body is. I made a lot of changes, and you're going to see those other markers come back down. I've seen that time and time again, and that's
Yeah.
just one example of when you optimize the body, those doses of medication don't change until you go get them changed. Whereas the human body, if you're not on a medication, will change itself.
I love that. Isn't that the truth? It's kind of, it's kind of awesome. And at the same time, it's kind of our biggest challenge, isn't it? Because in a lot of ways, we have a battle in terms of sort of communicating that. And then platforms like the ones that we're on, social media, and, it's difficult to really convey that. And we want to optimize the body. Let's do that first. See what kind of headway we can make, and then everything's going to be there, right? It's all going to be there. It's still going to be there in 30 days from now, whether we get on a really good detox and inflammation protocol, and let's check it out then. But that's, I feel like, one of the biggest challenges for sure, especially within our niche kind of in functional medicine, because what we're up against is the allopathic model, which is just let's band-aid it. Come on, let's get the band-aid.
Oh, for sure. Well, as we're talking about
Yeah.
hormones, what do you do for these women that are in the perimenopause? What's your process look like?
So I think, again, depending on the stage, right? So very early, late perimenopause. And I'm actually studying right now. I started in November my certification in bioidentical hormone replacement therapy. And it's been kind of mind blowing because I didn't realize really how much I didn't understand. I've worked with a few practitioners and really referred out a majority, because like you, I don't prescribe. But now that I really understand a lot more, it's kind of mind blowing. I feel like I'm better able to direct the patient in terms of, a care plan, so that they can better advocate for themselves at that doctor's appointment. They're not kind of going in blind. So, for that woman that might be in very early perimenopause, where her sleep and her anxiety have just come out of nowhere and really taken over, I think that first and foremost, we're looking obviously at the gut and the liver, and then kind of really sort of determining, where's this stress coming from? Where's this toxic stress that we, kind of have a tendency as women to pile on, and all of a sudden, we're in our 30s or our 40s, and we've taken on too much. So what's the real stress management? What are we doing to regulate on a daily basis? A lot of women have zero nervous system regulation techniques in place, because everybody really, I think, in their mind thinks, I have to go to a yoga class. I don't have time for it. It's too far. It's too this. It's too that. When in reality, we can apply a lot of these really simple, regulation techniques sprinkle it, I like to call, throughout the day, so that we're constantly actually taking these intentional moments out of fight flight to get into the rest and relax. I think that is step one in addressing what's happening with the adrenals that's perpetuating the toxic stress. Then from that standpoint, we kind of look at, well, what are all the predicators of perimenopause? When did your mom go into perimenopause, menopause? From a genetic standpoint, do you have autoimmune disease? Did your mom have an autoimmune disease? Look at all those lifestyle factors that sort of impact that. And then, try these different, like Lane Kilpatrick, one of my colleagues that went through the hormone, he's the hormone specialist here on Instagram. Like he says, he's like, the plant stuff works great if you get it in early. So a lot of these women, okay, for the very early perimenopause women, when we look at the Vitex, the chasteberry, the maca, all of these nutraceuticals, I think, work really well when you're just early on in your journey. And I think when it doesn't, meaning, let's try it, right? Let's try it. If we're having the debilitating anxiety, the disruption in the cycles, let's go the plant route. And then if that absolutely is not a home run, when we figure out we need magnesium and all these other things, then we can start to look at micronized progesterone. And I think that in that sort of like domino effect, if you kind of move with caution while you're tightening up the gut and liver at the same time, it's just sort of like a beautiful evolution where you can honestly then look back and say, yep, that worked for me, that didn't work for me. And you're isolating all those provoking and palliative factors instead of just, everything at once, which I think is really not effective to get sustainable results.
Mm. Yeah, I mean, like you said, nutraceuticals have the space that they can work in. Pharmaceuticals have the space that they can work in. And it really comes down to the need. You mentioned nervous system regulation, and something I say to clients all the time, this time of year, so it's perfect for all of those people listening that just went through family dinners. If you had one at your house, or maybe you know someone like this, I always love to bring this up, and I'm always going to get myself in trouble. So I apologize if this is offensive to someone. Does anyone on here, give me a raised hand in comments, come on, that may overstress during the holidays? They either need their house to be ultra clean, the food to be exactly perfect, the decorations to be a certain way, and it stresses them out to the nth degree. And if you were to step back a moment and go, was all of that necessary?
Right.
Right? Like, I have so many people that I work with where it's not just that as an example, but there's many things throughout life that we run into that we just over respond to, whether it's you overeat, you over exercise, you over stress, you over clean. And when we realize that when you do that, you're giving up your energy. Mm-hmm. And that energy can be used for cleaning the house, decorating the house, making it perfect for your sister to come into town. Or it can be used to make estrogen or progesterone or melatonin so you can sleep.
Yeah.
And when we start learning that our body has an operating system and it only has so much to give, then you start going, okay, what is my priority? And if you look at the nervous system a little bit more like that, then you're not blaming yourself for like, I'm an anxious person, I'm a worrier. You're just going, no, I got to prioritize this over that. My health over, the perfect Christmas dinner. And by the way, I've hosted Christmas dinner for my family for like a decade now. And I tell all of my family members when I went from my half a duplex to my condo downtown to finally living in like an adult house, when I was in those little ones, I go, if y'all throw a complaint at me because my house isn't clean enough, my bathroom isn't tidy enough, my decorations aren't up to your par, you're volunteering for next year.
That's it.
And I just didn't care because I'm like, I love having my family here. It will be tidy. Yeah. But it doesn't need to be perfect. I'm not that kind of person.
Yeah. I know. I don't know. I thought that was just a female thing. So I really appreciate you admitting that, because that perfectionism really takes the joy out of what getting together with the holiday is really meant for. And it's so many women. It really is. It's so many women. Yes.
But how many women, while we're talking about this, have ever noticed that when they have an event like that, a Christmas dinner, a birthday dinner, or whatever it is, your cycle's off the next month?
For sure. Yep. Yeah. And then, I mean, even from that energy standpoint, right? When we're talking about prioritizing energy, the same thing goes for, once everyone leaves and everything gets picked up, like that's not the time to emotionally eat, because eating at night, your digestive system's going to prioritize using a lot of energy to really digest properly instead of sleeping restfully. That's a big thing. With the emotional eating, the late night eating thing, I try and get women to really kind of understand that takes energy too. That is going to affect your sleep because your body is still working. And then that next morning, what do we have? We're working on a tank on E. We don't have a lot of gas in the tank at that point. Between the stress and yeah.
And when you're stealing from tank E, because of Christmas, because of New Year's, family dinners, work dinners, whatever, you're stealing all the nutrients your body would normally be using for hormones, specifically your sex hormones,
Yeah.
like the ones that make you feel good, feel happy. Because what you're making is cortisol, which is your stress hormone, which is then blocking your feminine hormones, right? So you're not only blocking the feminine hormones, you're stealing the building blocks to get you through the next stress event from the holidays.
It's the truth. Yeah. It's just kind of like robbing Paul to pay Peter. You know, you just that whole cycle of like I'm just going through the motions, which I hear a lot from my patients, which is heartbreaking. But so many women go through this, especially the working moms that wear a lot of hats. It's just the going through the motions, and that's what it is. It's literally running on high cortisol, for real.
Oh yeah. I mean, trust me, I work with so many superstar moms where I'm just like, I don't
It's a lot.
even understand how you function. Like you are mom, and
Yeah.
as a dad here, like it is so interesting because I love my child. I mean, he's my world. But even just seeing my interactions of my mother and even female friends that are around us with my son, it's just a different energy. It's a different thing.
Sure.
But when you're a mom, a working mother, and then you're like planning all these dinners to be so amazing and doing all the school things, like there's a ton of energy used there. And if you're not regulated, if you're not doing those things, if you're not then bringing in the appropriate hormone nutrients to balance yourself, like you said, magnesiums, you know, if we're talking thyroid, like you need your iodine, you need so many different pieces of that puzzle. And if you're early in perimenopause, like you were mentioning, all the estrogen supports, then you're just at a deficit.
Mm-hmm. Yeah. And then throw in the fact that, you know, and I used to live in the Northeast, so a lot of patients come to me from the New York area, and there's no outside time, not in the winter months where it's bitter cold. And so throw in like a complete lack of sunlight, just not even going outside because we leave for work when it's dark, we get home when it's dark, and then we're in an office all day. So you throw in that whole just, it's almost like we're almost against, we're really going against what nature has intended for us. And that uphill battle running on high cortisol, depletion of vitamin D, you know, that the depression, I used to grow up, well, when I grew up in New Jersey, I grew up hearing a lot about seasonal depression. I never really understood it until I was in my 20s. And then obviously through our functional medicine studies that we've done, you know, you're kind of like, well, what does vitamin D have to do with that? Why are we calling it seasonal depression? And then you think about it, you realize no one goes outside. Is anyone supplementing? Like, can we get on some vitamin D, please, ladies? Okay, let's boost those levels so that we can be, I mean, a hormone in and of itself, vitamin D, right? Some people want to call it a pro hormone, you know, whatever you want to call it, we need it. And I even find that in the population of women that work, our parents, holding the house down, doing the holiday gatherings, they would really benefit from checking their vitamin D a lot more often than just once a year. I check mine 4 times a year because my mom grew up in the north and I have her mitochondria. So my mitochondria is going to tell me no matter what, I'm fluctuating 4 times a year. So I've got to support myself accordingly. So that to me, that little kind of simple thing that's really missing in that general doctor's appointment that women go to. We checked your vitamin D, it's normal. Well, when did you check it? You checked it in June? Of course it's normal. You're outside all the time. Like, let's get on that. Let's be a little bit more vigilant because that's another little key I find in the whole calm, joyous occasion of the holiday season that we're missing is proper nutrients, magnesium, vitamin D. I mean, those are 2 right off the bat that I could definitely say more women need.
Oh, for sure. Go grab your Therasage vitamin D mat that you can lay down on your bed and lay on it so you can
Get that.
there you
I have to.
go.
Yeah.
Get the cheats. That's not as fun as going on a vacation, but it's a lot more long lasting.
Perfect. That's awesome.
You know, I've seen questions coming up and just to tap into them
Yeah.
before we jump off here, but things like plastics affecting your hormones, absolutely they do because plastics are endocrine disruptors. So they attach to the receptors on your cells, blocking your natural hormones from getting in. So that's one thing there. And then there's all of the different chemicals out there like parabens that are estrogenic. So somebody said, you know, they're 79 years old and estrogen dominant, I'm going, well, there's two things that come to mind immediately. One, how many products are you using that have estrogen in them? So lotions, shampoos,
Candles,
um,
scented candles.
all the junk, all the fragrances out there. I mean, just simply get one of the apps like EWG on your phone and start scanning all the junk that you use on your body or the scents that you smell in your house. And you'll realize all this stuff has to go, and it's going to significantly improve your body's hormone pathways.
For sure.
And the second part was liver. Go back to liver. Like, if you're 79, you've accumulated a lifetime of toxins, and if you haven't detoxed them, then they're blocking up your liver. Your liver's not breaking down all the different hormones that your body's naturally producing, or the toxins that are coming in from all these other things we just mentioned. Yeah. And now you accumulate and have extra estrogen. I can't tell you how many women are estrogen dominant when they come into me. I do nothing, absolutely nothing targeting the estrogen at first. We just work on the detox pathways, work on liver, work on parasites and gut. We go back and retest hormones, and they're all right in the center where they need to be. And it's because now the body's doing what's supposed to.
Yeah. Removing any interference. And that's so funny that you mentioned parasites, because a lot of women, well, I would say 40 plus, when we talk about it, well, let's test for it, and the utter shock and disbelief that there's an actual parasite. And my whole thought is, well, if you made it to your 4th decade and you have not been dewormed, like, wow. Because, you know, I really honestly think, like, at some point you're gonna come in contact with a parasite, and it just is another little low-lying root cause that really doesn't have a lot of symptoms, but all of a sudden you feel like everything's breaking down in your body. But nobody wants to talk about those because that's like a word we don't want to use. It's too scary.
Well, here's the reality of parasites. Parasites are just as common as bacteria and viruses. There are just as many, they're just as common. You come into contact with them probably just as often with ones that you don't already have. So what does that mean? Whether it's on your fruits, your vegetables, the floor, your dog, your baby, the door handle,
Yeah.
You're coming in contact with parasites. Just like bacteria and viruses, every single time you come in contact with it, you don't necessarily get it.
Right.
But eventually you got a cold. So eventually a parasite got through and got into your liver or your gut and started accumulating problems that you were told are normal, like IBS or bloating or estrogen dominance. And that was just something that you were told to deal with. And the reality is, no, you accumulated some deficiencies in your body's biome, which would be your own cells, the bugs that are natural and unnatural, and then the toxins. And when that gets out of whack, you get symptoms. So get your biome back to normal, and then you don't get sick. You know how long it's been since I've been like sick?
Yeah.
It's been a long time because I focus on balancing out my body's biome.
Sure. I think if you lead with that, that's always a good plan.
There we go.
Yeah.
Well, I've had a lot of fun talking to you.
Yeah.
I know we've hit several of the questions as they were coming up. There's probably a ton more. Shoot us some messages if you want us to answer some questions, and we'll get as many back to you as you can. And thank you so much for talking.
For sure. Good to talk to you, friend. See you soon.
Bye.